Well, in light of current events, I thought it's time to talk about something that actually hits home with me pretty strongly, and that is chronic pain. There's a conversation happening right now about it, and uh, as unhappy as I am about how this conversation started, I'm actually glad we're having it because a lot of people are going through the same experience and not even realizing how common this is and that they're not alone. And how do I know this? Because my migraines were chronic pain. That wasn't just a bad headache on occasion. When I say I had migraines, getting worse and worse as a kid until they hit a crescendo at about 15, migraines were like wanting to crawl out of my skin and not being able to sit up or move at all. It was like being trapped in like being bound with pain and nausea and losing sight and being just trapped like that for a day or two. And then it would ease for a little bit and it'd be right back. And it was getting worse. And I got taken to doctor, and no one knew what was wrong. They told my mom I was nervous and wanted to put me on pretty strong medications, but didn't know why they wanted those medications. They weren't really treating anything. They were just trying to, anything they had. So my mom, to her credit, did take me around to different practitioners looking for a solution. And thank goodness that we found one. And for me, it happened to be chiropractic care, which is why I stopped everything I was doing at that point. I didn't think I was going to go into healthcare or be a doctor. I didn't even like people yet. I was 15. But every time. But anytime I think about it, and I'm 51 now, so that minus 15, it's been that long since I had migraines like that. But I am very aware of what my life was about to be like if nobody was able to help. And that is what it was looking like. It was looking like I was never going to get help. And no one can understand what that feels like unless you've been in that experience. And what I'm seeing is actually more people are in an experience like that than a lot of us realize. I see it because I'm in practice, but I was this close to not getting to do what I do and live the life that I get to live. And I like my life this way. And it wouldn't have gone this way. I wouldn't have been able to even help people. I can help people because I got help. But I'm one of the lucky ones. And not everyone is that lucky. There are people who just want to hang out with their kids and play with them after work and just can't because they have to go in a dark room. There are people who want to sit and work and, sometimes they drive for a living. Sometimes they sit at a desk and they can't because they can't sit still. Something goes numb. Something hurts so much that it's so distracting. They can't focus on their job. Now they're having issues with their job. That can go on for years and years and years. And what I've seen over the last 15 years, it's not just that people are struggling with it, and it is lonely there. Even when you got people around you who love you and are trying to support you, they can't understand what that's like unless they're going through something similar. You might be lucky and have someone right by your side that understands how to take care of you, but you might not. A lot of us don't talk about what's wrong because we just have lost hope. We just don't think it's ever going to get better, and we grin and bear it. And we keep it to ourselves, and that's a burden too. So no, I'm not happy about what I saw, this week with healthcare and chronic pain, but I am glad we're finally having this conversation because I had a feeling that at some point healthcare would bottleneck so severely that we would see something, not this, but something where people just hit their breaking point of like, I can't take it anymore. Not only do I feel like crap, but I can't even get help. It takes 6 months to see a specialist. I don't know how this is going to get paid. The obfuscation from the insurance company. Is this going to get covered? What is my cost going to be? Oh, you can't tell me? Oh, I have to go to a place 45 minutes away to get a test that takes 6 weeks to take. And because you say I have to go to that one location, I mean, everything is sort of being taken away from physicians who would like to help their patients. Like, I got into this to help. because I get it. And it sucks. It sucks to hurt and need someone by your side. You can say it as many times as you need to it sucks to just want to feel better and not want your whole day to be thinking about what hurts or what's not working and being frustrated and sitting on the phone with an insurance company trying to figure out what is available to you and what it might even cost. And what do you do if you can't find out what it costs until after you actually get the bill? It stinks. There's really no other way this can go, unfortunately, unless some change gets demanded. I would love to see full healthcare reform. Our country deserves better. We deserve better. We have tons of innovation in this country with so much available to us, but half of us can't afford it. Half of us are worried, me, half of us are worried of doing everything right and having one healthcare crisis deplete me of every good decision I made and everything I saved because I don't know what that might cost to get that thing. And I totally get the fear behind that and the frustration. I'm there with you. I'm in the same boat. And I really have been wanting to see change for quite some time. I wish I could have put the brakes on the last 15 years of what I've been watching happen. So I am glad to see people speaking. I would like to hear more of your stories. I am paying attention. I know all physicians actually at this point are paying really close attention to people's stories because we're in there with you. We're working late hours. We're taking so many more notes. You know, that doctor that has to be on the computer when they're with you really would rather just be with you the way they used to be able to, and now we can't. And it's for this. We're all in the same boat together. So I know it can be frustrating to want to get in with a specialist quickly, or, you know, it's frustrating to like play phone tag with a doctor's office. For the most part, those doctors went into what they do to help, and they want to hear what's going on. They really do want to help you too. And they're tired of their hands being tied. We're all tired of our hands being tied too. So just take this as an opportunity and tell your story. If you have a story and you're reading it and you feel like you can relate to that, speak up right now. This is a good time to have this conversation. Maybe we can see some changes.